Left bundle branch area pacing looks to improving the natural efficiency of the heart's conduction system. The Amvia Pacemaker platform is the first system approved for left bundle branch area pacing. Now, where this might help is improving the natural myocardial contraction pattern, and that putatively should reduce the risk of patients developing pacing-induced cardiomyopathy. So the impact of MRI Guard 24/7 is the ability to optimise and automate MRI scans for the patient having an MRI. I think this is probably the most exciting part of the Amvia platform, primarily as it reduces the burden of workload required for the cardiologist and the cardiac team, but also it reduces appointments for patients and the workload required in preparing before and after an MRI, which can be quite significant. I think we can best benefit from early check by having an assessment early on after the pacemaker implant that enables an awareness that the pacemaker is working well. So this is done at about the 2-hour mark following the implant. This actually allows facilitation of same-day discharge. What this then does is potentially reduce additional waiting time in hospital, minimising workload issues for the technicians and freeing up time for all teams involved, particularly if there's a busy day. The patients who could benefit most from closed-loop stimulation, which we would call CLS, are patients where there might be sick sinus syndrome, chronotropic incompetence, and particularly neurocardiogenic syncope. CLS adapts automatically to mimic the natural intrinsic regulation of the body by looking not just at movement, but also physical activity, emotional stress and physical stress to regulate the pacemaker functionalities of rate response. So what it provides the patient is a physiological heart rate adaptation from beat to beat, and the patients who benefit the most can try and achieve almost the right level of stimulation when needed, and this can improve their quality of life. So the impact of atrial ATP on both the patient but also the healthcare setting and the healthcare team looking after the patient will be that atrial ATP might be able to minimise the burden of atrial fibrillation, and that's an important aim. And one of the subsequent benefits is the minimisation of atrial remodelling, and subsequently also minimising the recurrence of atrial fibrillation. So the system that Amvia provides is one of optimising physiological heart rates and ability to minimise the atrial fibrillation from occurring, and also then in some patients, particularly earlier on, from minimising recurrence of atrial fibrillation to where it becomes symptomatic. I think the benefit of having a comprehensive suite of automatic options for CRT pacing, which comes with the Amvia system, is very useful for those of us as clinicians who are trying to optimise biventricular pacing for the patient. There are 3 new options that I think will really improve the patient outcome. The first is to now allow for 20 different left ventricular pacing polarities so that we can pace off the most optimised version to try and get the best outcome for the patient. The second one is for the Auto LV Vector Opt, which is an automatic system. It takes less than 2.5 minutes to try and identify which the best pacing vectors are. And then the third one is that simply when the pacemaker is working, when the patient isn't with you, that the CRT can auto-adapt to try and provide ongoing adaptation to the pacemaker and allowing for a more personalised response.